Hi, welcome in. Ah, what setting have I done here? Welcome in, everybody. I don't know the setting I've used here, but it's okay. We'll keep it going like that. Let's go. So we want to talk about low back pain, okay? Low back pain, and I've pressed something. I don't know what I did press, but welcome in, guys. Hello. Hi, mommy. How are you doing? So we want to talk about low back pain, okay? We want to talk about low back pain. We are here. Welcome in. Welcome in. You know, I'm not good at streaming here, so we want to just try it. And guys, as you are here, please kindly subscribe to our YouTube channel, okay? Hey, Denise, you are here. Welcome in, everybody. Welcome in, welcome in, welcome in. So we want to talk about low back pain here, right? As you know, I am new to YouTube, so I am still learning. So you forgive me. Let's start the business for the day. So we've talked about low back pain on the other side. Please, give us some likes also, okay? You see the hand up. Give us some hand up, okay? Give us some hand up. Let's continue. So we want to talk about prevention and treatment in terms of physiotherapy of low back pain, okay? Prevention and treatment in terms of physiotherapy for low back pain. Everybody give us some likes also. Let's continue. So as we've mentioned, low back pain simply means that you are having pain that is starting anywhere below your last lower rib, okay, between your last lower rib and then the ends of the gluteal fold, the fold at your buttocks region. Pain at that area up to the last lower rib, okay? Pain within that region. That is known as low back pain. We've talked about everything already, so let me not go back there. We mentioned that there are different types. You have acute low back pain. If this pain lasts anywhere up to 6 weeks or below 6 weeks, we see that is acute. And then we have chronic from 6 weeks up to what we call it, from 6 weeks up to anywhere less than 12 weeks. Then we have chronic low back pain. Daniel, welcome in. Then we have chronic low back pain, where you have the pain that is lasting 3 months or more, right? We talk about the types of low back pain and the causes. Let's go to the business for today. Now, prevention of low back pain. Let's talk about prevention of low back pain, and then we continue from there. Or better still, let's do the physiotherapy aspect of low back pain, right? Now, there are a lot of things that you have to do even before surgery. It is not every low back pain that we treat using surgical management. So take note of that. Some of the treatment we'll give you will just be without surgery, right? So there are a lot of exercises that you can actually do, okay? You can actually do to help you, okay? One of them is what? Low back pain exercises. Low back exercises. So one of the first thing that I want you to do, everybody, unfortunately I can't project here, but it's very important. Once you are here, also try and subscribe and give us some likes here, okay? Put a chair if you've been getting low back pain. So let's say let me use this pillow, right? This is a chair in front of me. I've been getting low back pain. I want us to go through the exercises for low back pain. I've been getting low back pain. One of the exercises that I want to do, Sienna, welcome in. One of the exercises that you have to be doing to relieve your back pain is this. Put a small chair in front of you, okay? And then put your foot, okay? Let's say this is my foot. I'm just demonstrating. So this is the heel of my foot. This is my foot. This whole place is my foot. This is the heel of my foot. So put it on the, and then the what we call it? Sorry guys. This one here. The pillow that you are seeing here. The pillow is a table. Now this is my foot on it. Put the heel, okay, on the table, and then stretch it. Okay. Try and bend towards the leg. Okay, my leg is here like this. My leg is here like this. My foot, this is my foot. I'm just demonstrating. Put your foot on a table. It could be a chair, a very lower chair that is below your knee level. Put your foot on it, all right? And then you stretch, you bend down your body towards your knee. Okay, you bend towards the knee. When you do that, you are actually stretching your back muscles. Okay, it is going to help you to relieve the spasms that you have been getting from this low back pain. So take note of that. So you switch over. After that, bring the left leg, also the left foot, put it on the table. Are we understanding what I've just said? If you are following the discussion, please let me know in the comment section. The good thing here is that you can also comment. Okay, you can also comment. If you are following what I'm explaining, let me know in the comment section. Okay, we are talking about how to manage low back pain without surgery, especially if it's not complicated low back pain. We are talking about physiotherapy, right? My settings, I press some things, I didn't know what to press, so I've just press things. But let's keep it going, right? Please, as you are here, also make sure you subscribe to our YouTube channel. No, I am just okay, hold on, guys. I'm going to, let me position myself, then I will demonstrate to you. Give me a minute. I want to demonstrate to you so that you can follow it. I like to be very demonstrational. So follow me. So I have a chair here, right? I have a chair here. This is a chair here. I have put a chair here. Okay, it is low, so I'm going to, okay, I think I should still push this in. Stay with me, guys. Stay with me. I want to demonstrate to you. Okay, so this is a chair. This is a chair here. I am having low back pain. I want to demonstrate something to you. I have low back pain. I have a chair down here. So I'm going to do back stretching exercises. What am I going to do? This is my right leg. I am going to put it on the chair like this. Okay, you can see my right leg. Please comment in the comment section if you are following. My right leg is on the chair like this. Then I stretch towards it. As low that you can as much as possible. So there is a chair in front of me. I put my leg on it, and then what do? I stretch myself towards it. As you are doing it, your knee will be stretching, your lower back will also be stretching. We are talking about physiotherapy for low back exercise. Okay, so my foot is on the table. Then I stretch. My other leg is on the ground. I stretch my back for some few seconds. Then I change over to the other leg also. Okay, very straight. Then I stretch. The table or the chair shouldn't be too high. Okay, just something a bit high, lower than your knee. It shouldn't be too high. Okay, so take note of that. That is number one thing that you are going to do. The next one is this, right? I have low back pain, so I knee on the ground. I knee on the ground. My knees are on the ground, right? Remember, I have pressed some things, so the setup is messed up. So forgive me for that. My knee is on the ground, all right? Let me bring it closer. Let me bring it closer. My knee is on the ground, right? So what do? My knee on the ground, my hand on the ground also, right? Hope you are following, okay? Then I'm going to now be moving in and out, in and out, in and out, in and out. So I am like this, cut, It's like you assume a cat position and then you assume a donkey position, okay? A cat position. So a cat, you see that a cat has that thing there. So I go down like that. Remember, both legs, my hands are on the ground like that, okay? And then my knees are also on the ground. So I do stretch out, stretching, 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 stretch out, stretching. So you can see my back, in, out, in, out, in, out, in, out. Are we following? Are we following? Let me know in the comment section. Are we following? Are we following? Let me know in the comment section. My setup is messed up, but it is okay. I think I'll get it right next time. Let me know. Are we following? Yes, yes. I've never tried this on YouTube, but I was advised to do it, so I am doing it. Please follow me. Forget about the appearance and all that. I pressed something because I didn't know what I was pressing, right? So let's continue. I'm very happy that you are doing it now. Okay. Now the third form of exercise that you are going to do is what we call the pelvic tilt. Okay, the pelvic tilt, or even before that, let me do the contralateral strains. Let's do contralateral strains. Contralateral strains. Contralateral strains. Now, so I have two hands, okay, two legs, which we all have. What are you going to do? You are going to put one hand on the ground, okay? I've put my right hand on the ground. If I put my right hand on the ground, I am going to put my left knee on the ground. Right hand on the ground, left knee on the ground, okay? Are we following? Right hand on the ground, my elbow is on the ground, okay? The elbow of the right one is on the ground, like this. When I put the right hand on the ground, I am going to put the left knee on the ground. So right hand to left knee. So they are going to be on the ground. Once you do that, you are now going to raise the left hand against what? The right leg up. So are we following? Are we following? Are we following? Let me explain to you. Then I will demonstrate. Right? We are saying that we want to strain or stress the back muscles. We want to stress the back muscles. Right? What are we going to do? We now want to do things that will help relax the muscles naturally, right? So we are saying that the next exercise that you can do that will help you improve on your back pain is what I am saying, that contralateral hand to contralateral limb, okay, on the ground, contralateral hand and contralateral limb on the ground. Then you raise the contralateral hand and contralateral leg and straighten them. So assuming that this hand, okay, this my hand is my left hand here. If I put my left hand on the ground, what it means is that I am going to put my right knee on the ground. Okay, I am going to, please keep chatting, You know, I've not done this before, so I'm just trying it. And my screen is messed. I was just pressing things. I didn't know what I was pressing. Another one I've just pressed. Like. Okay. Somebody is saying that you guys should do this thing. You should click on the like. Give me some likes. That is what he's saying. There are some things here. Me, I'm just pressing that I don't even know which is which. Away. Okay, let's continue. I think I'm just going to leave it, because the more I press, I mess things up. Let's continue. So we want to strain our back muscles, right? So when we do this, okay, my right hand is bent, the elbow is on the ground. When I put the right elbow on the ground, then I'm going to also put what? The left knee on the ground. Right elbow and then right knee on the ground. Once I do that, it means that this one is free and then the left leg is also free. I'm now going to raise the left leg, this hand which is free, against the other leg which is free. Are we together? So we have 4. 2 legs, 2 like this, okay? They are like this. This is the right, this one is the right upper limb. This one is the right, the left upper limb. This one is the right upper limb, lower limb, and this one is the left upper limb. We are saying that bend this one. Okay? We are saying that bend this one. Bend this one. Bend this one. When you bend this hand, which is this one, and you are on your elbow, supporting your upper body with the elbow, we are saying that bend it with the contralateral one. It's like this. So if I bend this one, I'm going to bend the opposite leg. So these ones are going to support me. That means that I'm now going to stretch this remaining hand against the other leg. So crisscross. You see the bending, how they were like this. 2 hands up, 2 legs down. Now I bend this one. If I bend the one this side, facing this one, I'm going to bend this one. Now I have this one's left. I am now going to straighten them. Right? Then I switch over. When I bend this one here, this one becomes straight. It means that I have to bend this one, and this one also becomes straight. So this is how it is now. This is how it is now. Okay? Let me demonstrate. So something like this. This is my hand. I bend it. I'm supporting myself, right? I'm supporting myself. Okay, like this. I bend it like this to support my body. Once I'm bending the right upper limb and supporting my body on it like this on the ground, I am going to bend my left knee. Once I do that, it means I have crossed my body, right? So after that, I have this one is left, but the opposite leg is also left. Then I'm going to stretch them together like this for some few seconds. And then I switch over to this one. When I switch over, this hand is going to be free. Once this hand is free, the opposite one will also be left in terms of the leg. Okay? If my right hand is free, it means that my left leg is also free. So I'm now going to stretch the right hand against what? The left leg. Stretch it for some minutes that you can, and then after that, you switch over. That is another form of exercise. Have you gotten it? Let me know in the comment section before we move on to the next section, because this is very, very important. Did you get the explanation for that exercise? Did anybody get what I've just explained for the low back pain? In the comment section, there is a room for comments, so please let me know. I'll get the setup right subsequently, but for now, forgive me. I was just pressing things, and then things got messy. Did we get it? Good. All right, let's continue. The next one that I want you to do is what? You lie on your back. You lie on your back with your knees bent. Okay? You lie on your back with your knees bent at about, let's say, 45 degrees. Okay? 45 degrees. When you do that, you are now going to support your lower back. Try to lift your upper body from the bed or the thing that you are sorry, from the things that you are just lying on, whether it's a mat or whichever that you are lying on. You are going to lift it. So you bend your knee. Okay? Bend your knee to about 45 degrees. Okay? Bend your knee to about 45 degrees. After that, what do? You lift your upper body, okay, as much as possible. Up and down in some few minutes. Remember, your leg is on the ground, so you are not straining your back this time fully. Your leg is taking part of the leg, your weight. So that is also another thing that you can do about that. Okay, bend your knees to about 45 degrees. You are lying flat on the back on a mat. Okay, your knees are bent. Then you are going to be moving towards your knee as much as possible that you can. You go back, do that as much as possible. The next exercise that you should be doing if you have a low back pain is what? You lie flat on your tummy. Okay, you lie flat on your tummy with your hands stretched forward. Your hands stretched forward. What do you do when you assume that position? Remember, the whole idea is to relax the back muscles and then the ligaments and other things, the tendons that are there that will make your spine very tight and be causing you pain, right? What do? So you lie on your tummy flat, okay, on the flat surface. Then you straighten your hand. Once you straighten your hand, you now be lifting yourself, your upper body, okay? Let me demonstrate to you. So, assuming this is it, I am like this. I am flat on it like this. Then I'll be straight. I am like this. I've done like this on my ground floor, okay? So, once I've done this, what am I going to do? I am going to be straighting myself up as much as possible, okay? I come back, straighten myself up as much as possible. I come up, whilst my elbows are on the flat surface. My whole body is actually on the flat surface. I'm lying on my tummy flat, but I'm supporting the upper body with these hands. So you do that. You do that. Something like that. Something like that. Something like that. Okay? Like when a cobra wants to bite you. Okay? You do that. So a cobra will be on the ground and then the head will be like this. Right? So you do like that and then you strain yourself up. You calm down, do it again. But all the other parts of your body are on the flat surface except for your upper body. So take note of that. Forgive me about the setup. I am still keep sharing and click on the finger button to attract other viewers. That is what somebody is saying. Me, I don't know. I'm still new here, so we'll keep it going. Right. So let's go on. Another exercise that you have to do for your low back is what we call the quadruple movement. Okay. Now, so you are going to lie on your back again on a flat surface. Okay. You are going to lie on your back. You are going to lie on your back. Okay, we've done the crisscrossing. Lie on your back. I want to demonstrate. Oh my. Okay, I think this may be better. So this is my leg here, right? This is my leg here. You are going to lie. Let me go back again. So this is my knee here. I'm lying on my back. So I cross this leg like this on it. I cross this leg like this over the other knee. Then I'll use this one to be moving it up and down slowly. Slowly, but whilst lying on my back. Yeah? Slowly. This helps to stretch our gluteal muscles, the muscles at our buttocks. It helps to stretch it. So when you do that for some time, when you feel tired, you switch over to this one. You switch over to this one also. You switch over to this one also, yeah? Switch over to this one also. Then you do it slowly. I hope you are following it slowly. Whilst you are lying on your back. I am demonstrating and therefore I'm sitting. You are supposed to do it when you are lying on your back. So take note of that. So you do that slowly. When you lie down, it is very easy to do that when you are sitting. It is not that easy, but it is easier when you are lying on your back. And actually, you are supposed to do it whilst you are lying flat, okay? So take note of that. You do that slowly, okay? You hold here to be moving up and down, up and down, up and down. Then you switch over when you are tired. Just cross as little as you can. Don't force it, because if you force it too much, you can cause other problem. When you do it and you get to a point that it is painful, please do not continue. You stop over there. Now take note of that. That is the next exercise. The next thing that you have to do is what we call the side plank. The side plank, okay? The side plank. The side plank, okay? The side plank. What is the side plank? So you are going to basically support your whole body. Your legs are together, okay? You put your legs together and then your whole body is on sideways on your heel, the side of your heel. I want to show you. So your whole body is going to be supported around here, okay? Here and also on your elbow. So if I want to be on the side, so I'm going to lie on the side like this. My elbow is like this on the floor, and then my legs are together. So I am on it like this. And my whole weight is now on my elbow, and then my leg, which is the side of my foot, which is now on the ground, right? So take note of that. That is known as the side plank. So that is also very, very important. You have to take note of that one as well as what you call it, as much as possible. The other thing that you have to do, which is so important, is what? You lie on your back, pelvic tilt, okay? You lie on your back. You lie on your back. This is also very, very important because, like I mentioned, your muscles, abdominal muscles, when they are weak, you can have other problems, right? So you don't want your abdominal muscles to be weak, right? Because that can create a lot of problem for you. So what other things can you do? The other thing that you can do is this. Lie on your back, okay, flat. put your hands at your back, all right? Once you put your hands at your back, also your knees flex at 90 degrees, okay? Your knees at 90 degrees, you are lying on your back, your knees at 90 degrees. What do? You are now going to be doing what? You squeeze the muscles in your abdomen. You move them inside. You guys, I don't want to show you something. I would have demonstrated my 6 packs to you, but if some of you see it, you will not sleep tonight. So take note of that. So you lie on your back, your hands behind you like this, okay? Your legs, your knees flex at 90 degrees, okay? Then you'll be squeezing your abdominal muscles, okay? You squeeze them inwards, not outwards. You squeeze your abdominal muscles inwards. Yes, if they see my 6 packs, they'll start salivating. I don't want you to start salivating, so take note of that. Yeah, but I hope you are following. It is very, very, very important. And those of you here, please, if you have not subscribed to our channel, kindly subscribe to it. Let's grow it together. God bless you. Let's continue. All right, so take note of that. So lie on your back, you flex your knee, and then you put your hands at your back like this, and then you'll be squeezing your abdominal muscles inwards, not outwards. This also helps to strengthen your yes, Dr. Guys, forgive me for the setup, okay? It's just that sorry, I'm just trying this for the first time, and I keep pressing things and some colors are appearing. I don't know where they are coming from, but forgive me, I'll get it right. All right, let's continue. Okay, so take note of that. Now the next other thing that I want you to do for me is what do you call it? You see how I think when I'm going to get a bed, because I like to demonstrate things. It's going to help all of us, I think, if I get a bed, right? So remember I told you earlier that you put your heel on one chair like this, your leg is straight, and you bend, and you bend. Whilst your leg is straight, you bend over it. The other thing that you have to also do is your knee is now flexed. Okay, flex knee. Okay, there are names for all these exercises, but I don't want to be boring you with those names. That's why I'm just demonstrating it. So flex knee, then you bend towards it. Flex knee. Your knee is on a table, on a surface or a chair or something. Then you flex towards it. The other one, your heel was on the table or a chair, and then you flex towards it. Okay, that is also very, very important. Now, another one that is so effective that, guys, we have to be doing if you have low back pain is this. You lie on your back, okay? You lie on your back. When you lie on your back, what do? Your legs are normally flat, okay? Your legs are normally flat. Then you bend one knee. You lie on your back, your legs are flat, you bend one knee. When you bend one knee, what are you going to do? You are now going to flex this knee to your chest as much as possible. As close to your chest as possible. Okay? That also helps to relieve pain at your back. You do that, then you switch over to the other one. Okay? You are flat on your back on the bed. Okay? Then what do? You bend one knee. You can support it with your hand like this. Then you move it towards your chest as much as possible. Move it towards your chest as much as possible whilst you are lying on your back. Remember, we are taking you through the physio exercises that you are supposed to do to help relieve your back pain. Kindly subscribe to our channel if you have not done that. Okay, you do that, you keep it there for some time, then you move over. You do that, you keep it over for some time, then you move over. All right, that is also very, very important. After that, what do? You now put both legs together like this. You are still lying on your back. I am demonstrating, and therefore I am in a sitting position. Okay, so take note of that. Take note of that. You put the two legs together like this. After that, whilst you are on your back, you are now going to move the two legs towards your upper body. You hold it there for some time. You are lying on your back. Remember, I am demonstrating and therefore I'm in a sitting position. You are lying on your back. So you move your two legs towards your trunk, your upper body, as much as possible. Move it. Move it. Can somebody do some of these things and confirm to me how the pain is? If you're having low back pain now, do that and give me a feedback. Lie on your back, okay, flat back, okay, flex your hip, flex your knee, and then stretch your legs towards your trunk, your upper body. Keep it there for some few seconds, okay. When it's painful, you stop. You bring it back. You go back and do it again, okay. This is also very, very important. You hold it there for some time and then you stop, okay. You go back and do it again. You hold it there for some time and then you stop, okay. When it's painful, you then stop doing that. That is also very, very important. So take note of that. The other one that I want you to do for your back pain, okay, the other one that you have to do for your back pain is this, guys. You lie on your back again. Whilst lying on your back, what do? You put a pillow or a towel. Okay, let me use a towel. I'll not be able to demonstrate because the way I'm seated, okay? But my towel, this is my towel. Not necessarily a towel or any cloth. Remember, you are lying on the ground, okay? You are lying on the ground. Your legs are flat. You are going to flex one of your knee or bend one of your knee to about 45 degrees. Then you put the pillow or any long cloth that you can still reach at the sole of your foot. I've just finished bathing. Let me demonstrate for you guys to see. So I am lying down. Okay? I am lying down. I am seated, but you're supposed to do it whilst you are lying down. Put the pillow under your foot like this. Okay? The other leg is bent. Okay? You can see that. You can see that. I am lying on your back, on my back. You are supposed to do it whilst lying on your back. Okay? You are supposed to do this when you are lying on your back. Your other knee that is on the ground, you are lying flat on the ground, but you've just given some flexion, ankle or knee flexion, meaning you bent your knee slightly, right? The other leg, you are now going to put my pillow. My towel is too big. Don't worry, my legs are very clean. I just finished bathing, so it is okay. You can see this. You are lying on your back, right? Once you are lying on your back, what are you going to do? You flex the other leg that is now left, then straight. Then you now be moving it from up to down. Have you guys understood what I'm describing? If you don't get it, let me know, because we are going to be doing this from time to time. Let me know in the comment section. Are you following the discussion? We are talking about low back pain. Low back pain. Physiotherapy, physio exercises for low back pain. There is a comment section that this thing right here, right? You can use it to send a message if you want. This one here. All right? So that is that. Lie on your back. Get a towel or any cloth that is long enough that when you are lying on your back, you can actually reach onto it, right? What do? I said that the remaining leg on the ground, just give it a slight flexion, about 30 to 45 degrees flexion or bending from the ground, okay? Now, the other leg, you put something, a long cloth or whether a towel, or I'm just demonstrating with a towel. This is my foot, right? You put it there, yeah? You put it there like that. And then be straightening it. From the floor, you lift it. Let me go back again. So, like this. I'm on the ground. So I lift it. Don't see anything through there. If you see the snake through there, you will not be able to sleep. You'll be there. I'm on the ground. So it goes up. I keep it there like that for some time. Remember, you are supposed to do this whilst lying on your back, right? Whilst lying on your back. You keep it there for some time. Then you bring it down. Then you go again. Keep it there whilst you are lying flat with the other leg slightly bent, okay? At the knee level, okay? You keep it there for some time. You do that, then you change over. Now I've changed over to the other one. Now this leg is now going to be on the ground, right? You change over. Don't see anything. Or if you see the thing inside the trouser, you'll be dreaming about it and licking your mouth in your dreams. But I will not be there for you. You'll be there. All right? So let's go. So we've done for this leg. We want to do for the opposite leg also. So let's go. Stretch it whilst you are lying on your back. Stretch it. Keep it there for some time. When you are doing that, you find that your knees, the muscles at the back are stretching, your back muscles are also stretching. Hold it there for some few seconds. If it's beginning to hurt, bring it down. Then you go again. Straight. Your leg should be straight. The leg that you put the cloth under the sole, it should not be flexed. It should be straight. But the other one on the ground can have some flexion inside there. It is okay. But the one that you put the cloth on should always be straight. Okay? So go. Keep it there for some time. Then you bring it down. We are going through physiotherapy for the back. Okay? You have been getting chronic low back pain. I've told you that majority of chronic back pains can be treated without surgery. They are actually treated without surgery. I gave you the indications for surgery when it comes to back pain, all right? So here we are just going through physiotherapy. So you do that, you do that, you do that. You keep it there for some time. Another important one is this one. So this one, all those of you here, if any of you are having back pain, I want you to do it right now and come and give me a feedback. So, on your, let me do it here. Can you see me here? Okay. So, I'm on my bed. I think I have to go back. Okay. I'm just trying to demonstrate, right? So, this is my bed. This surface is my bed, right? Or the floor, a flat surface. So, I want you to do that right now and give me an instant answer how your back pain is feeling. So you are going to bend. Everything. My foot is there. I've bent on it like this. Then I go down on it like this. I'm just demonstrating. Go down on it like this. Then you stretch your whole body. My hands, everything is stretched like this. If you are having back pain now, I want you to do that and give me a feedback right away, okay? We are demonstrating. So I kneel on my bed like this. Then I go down on it like this, okay? Everything is on each other. Then now my upper body will now come to my thighs. Go slowly. If you've never done this before, don't go just forcefully. Go slowly. Then I go like this. I bend like that. Then my hands become stretched. Okay? My foot is also supposed to be going backwards from the ankle level. It's supposed to be on the bed like this. If it's a floor or whichever, it's supposed to be on it like this. Not this way. No. It should be like this. Okay? Everything should be straight. It stretches everything right from your foot to your knee, to your back, your hip, and everything. Then we go like this. Sit on it, then like that, then the hands up. Your hands have to come up as much as possible, yeah? Assume that position for like some few, even if it's 1 minute. Do that for 1 minute if you can. Whilst your hands are stretched, your shoulders are being stretched. All right? I hope we got it. All right? That is also very, very, very important, and it helps with low back pain. We have 23 viewers, but we have 21 likes. Come on, guys. This one is free. It is free. It is free. So take note of that as well. You have to remember that low back pain can actually, in a way, apart from the degenerative condition, you can actually prevent it. All right? So we are going to talk about prevention. There are other complex exercises. I want you to guys to start with these basic ones that I've taught you today, and then come and give me a feedback. After 1 month of trying, let me know. Remember, if you have a spinal infection, let's say you have TB spine or Port disease of the spine, okay? You are not going to be saying that, oh, exercise is going to cure the infection. No. When it comes to infective spondylitis, exercise does not take that away, right? Let me take some water, guys. Exercise is not going to... I am very flexible. All the other things are flexible. Oh. The other thing too is very flexible, but power. Let me take some water. So let's talk about prevention of what? What do we call it? You want to sleep? Okay. I've hijacked my son's room. And now he's telling me he wants to sleep. All right. Let's talk about prevention. Prevention, and then sorry, we will call it a day. Remember, there are other complex exercises, but I don't want to take you through that. First, try these common ones that I've explained, and then we will... And don't worry about the screen. I don't know how to set. They have a lot of things I'm seeing here, but I don't know which one is the correct one. Or just pressing things. That is why the color is like this. But it is okay. Let's talk about prevention of low back pain. How do you prevent low back pain? Or guys, let me ask you, should we do prevention tomorrow? Should we do prevention tomorrow? Okay, I think let's do it this way. Let's talk about prevention tomorrow, okay? Oh, actually, so here also you can actually share the live stream. When you click on the small dot on your lower right corner, right? There is an option to share to people that you know on this place. Dr. Puritan, how are you? Good to see you. So guys, let's talk about that tomorrow. But from now on, that is what we are going to do. We do some sessions on my platform, then we move over here to do some sessions also. My name is Dr. Felix Mawuko, and a specialist orthopedic surgeon. I am new to this YouTube thing, so forgive me. I'm going to get the setup and all the other things right at the right time. Today we have learned about physiotherapy for low back pain. Tomorrow, God willing, I will stream again on how to prevent low back pain. Okay, so I'll catch you guys. I'm going back on the other app to talk about cervical cancer. If you have the time, let's move over. God bless you. Catch you guys. Now see you later. All of you who followed me here to come and listen to whatever I want to say. Remember, we've not finished. This is part 1 of low back exercise. Okay, we'll do part 2 of low back exercise, and also we'll talk about prevention, God willing, tomorrow. Right, guys, next time when we come, because we are sharing, we didn't know. I've just been told. I've tried it. This small button here, when you click on it, you are going to see that there are an option to actually share the live stream. Right, guys, let me take your feedback. Should we continue or we start tomorrow? I think we should come tomorrow and talk about prevention. Okay, God bless you. Have a lovely day, and thank you guys for the like and all the other things. Bye bye everybody. See you.